I'm pleased to welcome Rebecca Rogers from SAIL this morning. Becky's going to be talking about sharing active, independent lives, everything you always wanted to know about SAIL and the Village Movement. This is a very interesting organization, this SAIL gang. They've been great partners here with Triad over the years, and I'm really happy that Becky had the time to join us today. And I think I saw Ann Albert here too from AgeBetter. And feel free to jump in. Don't trample on Becky's toes, okay, though? All right,
Uh,
Becky, please go ahead and take over.
Thank you.
Uh, Good morning. Thank you so much for letting me join you today. I'm going to pull up my topic here and get started today. All right. Well, like Mike said, my name is Rebecca or Becky Rogers is fine. It gets a little confusing because my email says Rebecca, but I go by Becky. So maybe when I'm 90, I'll change to Rebecca. I'm not sure. But anyway, I am the Volunteer and Member Services Specialist with SAIL. I've been here 6.5 years, and I've worked in healthcare for the last 36 years, about 30 of those working with older adults. I'm delighted to be here today and to have the opportunity to share an update on Age Better and our programs. And before I start, I just want to extend my really deep appreciation to all of you that are here today and those in the community. Without all of you, SAIL wouldn't be here today, 20 years later, serving 500 to 600 older adults each year. Thank you all for what you do for our entire community. We know that it takes a village, and I hope that you feel extremely good and proud of what you do each year. Older adults are the heart of the overall well-being of our society. And I hope you know how much your support impacts all of those lives. People are living longer, and there's naturally more and more people with chronic disease, physical and cognitive challenges. And Age Better is a perfect name for our organization because that's what we're all about, aging better together. So Age Better Inc. is located here in Madison, and we are a 501(c)(3) organization. Age Better has member organizations, our current members who are actually founding members, Oakwood Village and Attic Angel Association. Together, those two organizations have approximately 200 years experience providing housing and healthcare services to older adults, like life plan communities, formerly known as CCRCs. Both of them are nonprofit. In 2005, they founded SAIL, originally titled Supporting Active Independent Lives, which we changed in about, I believe it was 2018, we changed it over to Sharing Active Independent Lives. We shortly became part of the Village Movement, which I'll talk about more. I do want to acknowledge the amazing vision and commitment of these two organizations that they demonstrated 20 years ago and throughout the past 20 years by supporting and encouraging SAIL as one of its programs. They also remain vigilant about allowing SAIL to evolve as a village model, to operate more or less as a grassroots organization driven by its members and their needs. We have 6 board members, including the CEOs of both Attic Angel and Oakwood, and 2 appointed members. SAIL is an extension of the mission of Oakwood and Attic Angel in the community because they know that not all older adults can afford to live in a life plan community. So they recognize the importance of having options. So this is our mission statement. You can read it on your own, but I kind of tell people that over 6.5 years, I learned my little elevator speech about SAIL. And I like to say that we are a nonprofit organization for people aged 55 and older, and we offer information and resources to allow folks to be as independent as they choose to be. And I forgot to mention earlier, if anybody has questions throughout this presentation, please feel free to put them in the chat box or ask them right away. Um, it'll be harder for me to see all of your faces, but Mike can help me out if anybody has a question. Thank you. So this is a little description of a general description of the village that we have here. So our Age Better programs. Just let me get find my right notes. Okay. So the description here is a general description of a village. You can notice three key words here: membership, connect, community. If you've heard our executive director, Ann Albert, who's on this today, talk about her little infomercial, you've heard her say, if you know one village, you know one village. Villages are as unique as the members and the communities that they encompass. We all know that aging successfully is not a one-size-fits-all proposition. Our needs and our assets are unique for the most part, and yet in some ways they're the same. The beauty of the village model is that it lets us be unique and at the same time glean from others around the country who share the same challenges and are finding solutions. You also see that there's a description of our Safe at Home program here, but you'll need to tune in next month to the Triad presentation to hear my coworker Diane Turner talk about what that Safe at Home program is all about. So SAIL celebrates its 20th year anniversary this year. We opened our doors on March 1st, 2005 with 30 members. Today we have an average of about 500 active members each year. When SAIL started, we had no idea that another very similar organization existed in Boston, the Beacon Hill Village. One day, a member came running into our office waving a copy of the New York Times. She said, "There's another organization just like ours." So that publicity triggered great interest across the nation, and SAIL became a founding member of the village movement and is the second oldest village in the country and one of the largest. There's approximately 280 villages like SAIL in the United States and internationally. There's 50 in development, 3 in Wisconsin. So other than SAIL, there is Do Good Door in Door County and Felician Village in the Milwaukee area. So why are villages needed now? A 2010 survey by AARP found that nearly 90% of older adults want to stay in their homes and their communities as they age. The village model helps older adults to age in a place of their own choosing, connected to their communities, with the practical supports and the tools they need to create successful aging of their own design. Villages are well proportioned or well positioned, to improve the population health of the communities they serve. In Britain and the United States, roughly 1 in 3 people older than 65 live alone. And in the United States, half of those older than 85 live alone. Studies in both countries show the prevalence of loneliness among people older than 60 ranging from 10% to 50%. The village model works. Village members consistently report a positive impact on their well-being and quality of life as a direct result of their participation in their village. The pictures that you're seeing here aren't stock photos. These are pictures of current and past SAIL members. The original SAIL members, our charter members, there were about 30 that started this. We still have 12 of them as our current members of SAIL. We strive to connect members and have found that by even doing social gatherings, such as our 90s lunch event, where all of our members aged 90 and over gather together and share their stories with each other. And they remain a vibrant part of their communities. And we all know that having something to look forward to gives us a positive outlook. And just to share a little quote, Eileen Henshaw from AARP and the Department of Government Affairs says, villages are instrumental in helping people remain in their homes and independent in their communities. So, on average, about 65 to 70% of our members are single. Most live in private homes or condos. Some live in apartments. Some live in congregate senior communities. We have folks at Attic Angel. We have folks at Oakwood and other places. They range in age from 59 to 104. And our 104-year-old is still living very actively, independently in her own home for more than 50 years. 66 of our members are over the age of 90. Members pay dues, and there are two levels of membership, a full and an associate. We also offer a sliding fee for those members who are income challenged, and we use the HUD guidelines to determine the rates for those memberships. I encourage you to visit our website, saletoday.org, and you might learn a little bit more about SAIL. You're also welcome to visit our AgeBetter website. So, with the exception of our Safe at Home program, AgeBetter receives no government funding. We rely only on member dues, sponsoring organization support, and grants. For instance, the Oakwood Foundation grants help support programs, services, and our sliding fee program, and all of our donations help fund our program. Last year, our members donated a little over $90,000 to SAIL, and some of that was donated to our endowment fund at Madison Community Foundation. We have a strong volunteer program, and as you may expect, we know that the more a member puts into an organization, the more they get out of it. Each month, a volunteer is highlighted in our monthly newsletter, and we think this helps to encourage others to volunteer as well. If you find out that you can do one simple task every month, or you can do a little bit more, any little bit will help somebody else. So let's talk a little bit about our SAIL benefits. When SAIL was first created, we surveyed older adults and asked about their obstacles to staying in their homes. We learned that there was great concern about knowing who to hire for home repairs, home maintenance, personal services. Thus, we started the service provider directory. Most of our service providers are referred from a member, and then an extensive process of vetting begins. We check the Better Business Bureau, the Consumer Protection Agency, do a nationwide background check, and on it goes. Service providers also pay a small annual fee and must remain up to date on their insurance in order to be part of our directory. We have providers ranging from carpentry to housekeeping, to window washing and everything in between. We also have a section of professional service members that includes elder law attorneys, an audiologist, real estate help, and more. A member also shared she was concerned about someone knowing she was up and about each day, and so we created the Rise and Shine program. Our Rise and Shine program is a very unique program in that 365 days a year, someone will call in and leave a voicemail message, and we know that they are up and about for the day. We also check in on them if they do not respond to the Rise and Shine check-in call. This is a very unique offering for our full sale members. One member shared that this program saved her life. So she gave us permission to share her story. She hadn't called in one day, so the sales staff, we reached out to her and we couldn't get in touch and we couldn't reach her direct contact person. So we made a trip over to her home and to check on her. And well, long story short, we ended up calling 911. She had fallen overnight in her bathroom and when was unable to get up. Found out that it was because she had an undiagnosed pneumonia. And so she shared that had it not been for Rise and Shine, who knows how long she would have been laying on her bathroom floor waiting for someone to come and help. We currently have about 40 members that participate in that daily check-in service. We also have one of our service providers as our tech guru who helps with dozens of members each month. Since we are a small staff, we also rely on volunteers to help out with member groups, office help, gardening, driving, handy person assistance, and more. Our volunteer program is somewhat unique as we do not require a minimum number of hours to participate. We have some volunteers who help out twice a year, others who we see weekly. In our yearly perks that we offer, one of them is an electronics recycling event. Last year, we had the opportunity for members and members of the community to drop off unused appliances at both of the Oakwood campuses and at Attic Angel. We worked with the company File 13, and together over 2,400 pounds of electronics were saved from the landfill. So we're pretty happy with that program. Last year was or this year was the 11th year of partnering with the company Two Men in a Truck. And sale members are invited to sign up to have an item moved within their home. For instance, we had someone who had a heavy rocking chair that they wanted moved from an upstairs room to downstairs. And it doesn't sound like a big deal, but if you're 90 years old and maybe can't do that on your own, it was a great service to provide. They also include a junk removal service. And so we had a lot of folks that were able to get rid of a lot of things out of their home and help eliminate some of that clutter that takes a lot of space for everyone. Social isolation was also a concern that members had, and we began offering social events and educational events. We encourage and support members in creating interest groups. And during the pandemic, for instance, we had several members who were concerned about getting the blues. And so a panel of members created a Zoom program for all of our members, calling it Beating the Winter Blues. Each panelist was able to share what they do personally to try to stay upbeat. And it was a very well received program. And like I said, as we hear from members requesting specific topics to learn more about, we do our best to find qualified presenters to present those types of workshops. So let me tell you a little bit more about our specific workshop series titled Sailing into the Future. And so the Sailing into the Future workshops were developed basically to introduce the components of the aging plan. And so all of these sessions can be very interactive and go from one to the next. A person doesn't have to participate in them in any particular order. And if a person would like to just do one, that's just fine. The last one that we just came up with this last year we debuted was Being in the Right Place, navigating options as we age. Well, during the development of this program, all of our other workshops are just one workshop for about 2 hours. Well, This one had to be a three-part workshop because there's so much information to be shared. So, in that workshop, they start with looking at the reasons why people choose to live where they live. It also features a home assessment tool where we highlight recommendations for accessibility and safety. During that workshop, participants are encouraged to examine their own motivations for staying in place or thinking if it's time to make a change. Then they move on to part two, where they decide on what living options and looking at creative ways to help you stay where you are longer. Maybe it might be with tools or life hacks, as we like to say. There might be things that a person can do. And part three goes into a decision toolkit, which evaluates the best fit between a person's current residence versus maybe the residence that will um, be a better fit for them. And that workshop was a very successful debut. We had about 65 people that participated in those workshops. You and Your Money is a workshop with a presenter, Connie Kilmark, and she doesn't really talk about money specifically, but more about your money personality and might ask you questions like, how will you adapt to the challenge of spending after a lifetime of saving? What are your goals? How do they align with your life, with your income and your spending? What's your financial personality? It's a great workshop to participate in. We recently had the Living with the End in Mind with Julie Swanson. And Julie is a death doula. And so people that participate in that program learn basically to be the author of your life story and explore what really matters and find out the four most important things to say as someone is getting closer to the end of their life and looking at different resources and meaningful practices. The Aging 101 workshop is with Dr. Alexis Eastman, and she talks about uh, the 10 key things that we should all know about normal aging. And she helps us understand that aging doesn't mean disease, nor does growing older mean we'll become frail. So it's exploring a lot of those myths about aging. The Change Happens workshop, when change happens when life gives you lemons. So in that workshop, presenter Claire Dahl goes through finding ways to respond to life's like inevitable curveballs. We know that change is all around us, and adapting can take grit, determination, and leveraging our own strengths. So, looking at that wisdom gained through years of experience, you build resilience in the face of change. And finally, that last workshop listed there, Thriving in Life's Next Act. It's a program tailored for folks older than 55, and it's looking at things like saying goodbye to the myth of midlife crises and hello to a journey brimming with fresh possibilities. Um, Mary Helen Conroy and Galen Metz kind of work together to have a great topic on living in your next act. So we encourage you to participate in those programs.
Becky, I wanted to jump in here real quick
Mhm.
with the, 500 to 600 members in your organization. You obviously have a lot of talent within the membership. To what degree do they uh, come together in small groups or as a whole, or even individuals to help arrange for all of the things that are going on in your village here? I mean, it's very interesting that you've got all these things going on. How involved are the members?
Our members are very actively involved. We have of our 500 members, we have about 80 volunteers, and a lot of those volunteers are the ones that lead the member groups. So, for instance, if we if we hear from somebody that they want to have a presentation on hearing better, we reach out to somebody and have a program from, we had a program from our audiologist in our service provider directory, and she did a program and presentation on that. As our members give us a call every day, they talk to us, and if they have concerns about specific programs or things that they would like to learn more about, we will do the research and find if maybe another organization or community partner is doing a similar program, and we will highlight that for them and say, oh gosh, check out the Alzheimer's Association. They're doing this program, or the Senior Center is doing a program on this topic. And so we do we listen to our members and really try to have them be as involved as they can be. Good
Yeah.
question. Yeah.
Thank you. Thank you.
Excellent. Okay. So, we did a member survey in 2023, and was kind of neat to find out that the number one benefit that people felt about sale was peace of mind. So many of our folks shared that they might not need an offering that we have every day, but just knowing that we're here is important. It might be something very simple. For example, we have one member who is legally blind, and she'll call us on occasion to get a phone number for a doctor or for a clinic. And it's kind of fun to listen to her because she always says thank you and goodbye before we give her the number because she knows she has to call right after she gets the phone number. So she'll get it and she'll repeat the number and then she'll hang up. But she's so appreciative that we can have that resource of just that little phone call that she can give us a call and get that information that she needs. Members are also happy to know that when they call one of our service providers, they're going to get someone they can trust. We're not like an Angie's List. We have actual testimonials for all of our providers, and we meet each single provider before we even have them on our directory, and they go through a whole process. So it's a very special service provider directory. Our educational programs have included updates on Medicare, Social Security, and like I said, the Hearing Solutions program that we had. And we also share resources from other community programs and events. One of those is Only Leaves Should Fall and No More Spring Breaks. So some of the very effective falls prevention programs that we partner with Safe Communities, Madison College, UW Nursing, Pharmacy, and Physical Therapy programs are all involved in both of those group community events on falls prevention. Having all of those have just been such a successful arrangement, and we're very happy to be a part of that. So having connections in the community is very key for us. You can see that we have a lot of folks that we collaborate with. We're proud to be part of all of these programs and consider other collaborations in Dane County. For instance, one of our member groups is our diversity team. And with that group, we try to connect with other cultures through visits at their communities or through meals. We've participated in 10 lunch outings at local restaurants, local ethnic restaurants, where we not only get to eat some amazing food, but also arrange to have their chef or their owner talk about that food, how it was prepared, how long the recipes have been handed down from generation to generation. And then we also ask them to share how the elderly are viewed in their community and in their culture. And it's just very fascinating to find the differences and the similarities in all of us all around the world. We've been to Sultan on Willie Street and had a great presentation from the chef there. Silk Road on Park Street. Had some amazing food, a lot of things on skewers and shish kebab type of food. But his presentation to talk about his life in Tajikistan, I don't think I say that correctly, but you know what I'm talking about, was just fascinating to hear. We've also visited the Sikh temple and had a chance to hear about their community. We always are learning and trying to expand those connections in the community. We also know how much our members connect with each other outside of SAIL sponsored events. At a recent SAIL members' birthday party gathering, about a third of her guests were all friends that she made through SAIL. And so we were very happy to know that that is happening. This is our team. So we are a very small group. Ann Albert, our executive director, is our founder of our program. She's been there for 20 years plus. And so she's been keeping everybody going. Again, I have been here for 6.5 years. Crystal Delwich is our office coordinator, been with us just over a year. And again, you'll hear more from Diane Turner, our Safe at Home program coordinator, next month. So, Age Better and SAIL are all about connections with community and with each other. We're so thankful to all of our community supporters. So if you would like any more information on SAIL, you're welcome to visit our website. Again, it's thesailtoday.org, or feel free to email me. You could email me at rebecca.rogers@sailtoday.org. I'm happy to answer any additional questions that you might have today. I know this was a very brief presentation, so I'm going to stop sharing and see if you have any questions. And if you don't, that's okay too.
Feel free to jump in, everyone, if you have questions for Becky. And maybe we can even drag Ann in here if she uh, has time here. I had one question, and you mentioned the villages here in Wisconsin, and they're mostly in uh, Madison and Milwaukee, right? That's what I gathered. I would think that any uh, city, even as Janesville, could.
Oh,
Oh, there we go. I
okay.
would think that I'm wondering about what the key factors are in forming a village. Anne's been at this a long time, has a lot of expertise. What do you think, Anne? Uh, I mean, why don't we have villages in Janesville or in, more medium-sized cities? Or, I mean, do you think that,
Um,
what do you think?
so we have helped some villages get started across the country, and then we attempted to help a few that actually never came to fruition. So I guess, I've had that experience. We were working with a group, for example, up by Stevens Point, and it was very close to really taking off. But what the problem or the challenge was for that particular group was being able to form a strong and large enough cohort of people that would get it going. So um, the villages, like Becky had mentioned, they're all different. I mean, some are sponsored like we are by other organizations. And then there are some that are completely grassroots, and some are completely volunteer. Um, Not all villages have paid staff. Most do, and most find that they really need to do that. But so they vary across the country. But I would say probably the biggest factor is having enough, a good size group of people that know there's going to be a lot of heavy lifting, especially in the beginning. As far as being volunteers. And the village that took off and is doing very well is Trail in Iowa. TRAIL. They're doing well. They were grassroots, but they had a strong cohort of people of varying backgrounds, all retired, who really put together a wonderful organization. But I think that's definitely really key.
Thank you, Anne.
Mhm.
I was wondering about that because, you know, in the past, religious organizations functioned as strong central points of organization and
Mhm.
could spur members, you know, of the congregation to get busy. But as we see less and less involvement in organized religion,
Yeah,
it's a
I
little more
think
difficult. Yeah, go ahead, please.
I think too, I think really it's important if a group is starting out is, obviously the collaboration. So we are seeing more of that, which is really exciting, collaborating with local senior organizations, the Area Agency on Aging. Some villages are collaborating directly. So I think that holds a lot of potential as well. And certainly we have connected with different church groups, and that's really important as well. But, we're not, the important thing is to really be clear on the uniqueness of the village and how we complement and support the services. We actually complement what is already being done and not duplicating or competing. There are a lot of older adults in our population, and there is no one size fits all for everyone. So I think that collaborating and really trying to partner with existing organizations is a good point to bring up, Mike.
Okay. Yeah, and anyway, I mean, we have 22 people here. If other of you have ideas on this, please join in. I'm just interested in, you know, this was one of my questions. I was thinking here, you know, just about RSVP. You know, if we didn't have an RSVP office, with, paid part-time staff and a few full-timers, I don't think we would have nearly as active of a program. I mean, you need a certain core to keep the program functioning. And
Exactly. Well, and that's where we rely so heavily on our volunteers as
mhm,
well. And volunteers really are the heart of SAIL. I think, we use our volunteers for, like I said, not only leading programs and being a part of our SAIL council, but our volunteer drivers, volunteer handy people. So with only three of us on staff, volunteers are key.
mhm.
And just for you as well as for you. I mean,
No, that's
yeah.
true. You know, like we're
Mhm.
getting this new computer, tech skills classes
Yeah.
going here.
Yeah.
And, originally, I can do, some of these classes, but, you know, we just need volunteers who can do the actual work, of presenting these topics. So, Christine, I see you there with your hand up. Please join in.
Um, yeah, I'm actually a member of SAIL and president of the operating council. And I would just like to emphasize the point that yes, it really takes a core group of the members to be active and involved in guiding things. And we're, as members, from a member perspective, feel that we're fortunate to have the size of organization that allows us to have wonderful staff to do all of the structure of work that makes things happen. But I think it is unique from the perspective that as older adults and members of SAIL, we recognize we want to stay in charge of our lives. We don't want to sit back and wait till some organization or a health provider or a child of ours says you need XYZ to do something in your life. You need to move from your house, you need to stop driving, you need to do this or that. if we stay more active and in control of what's happening in our lives and use the supports of what sale can offer. So if I don't feel like I can drive anymore, there are volunteer drivers who will take me to sale events, who will take me to the grocery store. Many driving ride services will only take you to medical appointments. Well, not true within sale. It's whatever we need to help us to be more independent. And the same is true for living in your home. There might be simple things like I can't change the light bulb that's in the ceiling, or, and how do you hire someone to do that? Well, a handyman volunteer can come and do that, or put salt in the water softener, or, a lot of the little things that sometimes make it difficult to stay in our homes. So I just add that to reinforce the value that the collaboration between the members and the staff that make this such a rich organization.
Mhm.
Thank you, Chris. Yeah, I appreciate that.
Yeah, Rich, go ahead, join in.
Yeah, hi. This is Rich. I work over at the ADRC here in Dane County. I sorry I've been in and out because I've been having phones ring and stuff too.
Mhm.
But I did hear mention of like trying to expand into other counties. We at Dane send a lot of people your way because sometimes they don't fit into other programming. So I'm wondering if maybe reaching out in some of the other ADRCs might be helpful to kind of generate an awareness of sale in more, other counties where it's not necessarily strong and gather more support that way as well. So that was just my one little segue. And because I have been in and out, are you guys going to be sending out like a link to the slides and a recording or?
Yeah, I think Mike has recorded this, so
I'm
yeah.
recording this, and all of our programs, pretty much, almost all of them, are at the YouTube channel, Triads of Dane County YouTube.
Oh,
And
okay.
I think we have 83 videos over the years. First one we started off with Tracy Schrepfer, who was talking about aging and substance abuse problems, and we've gone on from there. So yes, this one will be included there also.
Cool. Well, thank you.
Mhm.
I appreciate it.
You're welcome. I'm wondering about the geographic component of this. I had a lady talk to me the other day whose mother just moved in with her, and she was trying to find, because she can't be there to be the taxi all day, how to get mom around to things. And I hadn't really thought about your ride service. I know, you know, the drivers around the county, giving medical rides, that's one thing, but taking mom to the quilting club, is different.
Mhm.
That isn't generally available. I'm wondering if she, is there a geographic component that is Sale mostly in a West Side organization, or is it all over the city?
We do serve all of Dane County, and so we do have members as far-reaching as the DeForest area, Sun Prairie. We have folks out McFarland, Stoughton, all the way out to Blue Mounds, and so we do our best to provide those full sale members. It is a full member benefit, the ride program. And so we do offer that for our members to get up to 4 rides a month. And so if we do have a core group of folks that do take pretty good advantage of that ride program, and they are also, when they pay their membership dues, they realize that the cost of the dues alone would cover those ride costs.
Mhm.
If they had to hire a taxi for every single one of those rides, it balances right out. And there was a question in the chat box about the sliding fee scale. And I did see that as well. The sliding fee is really for folks that let us know that they are income challenged. And so we do follow HUD guidelines to determine their rate for their membership. But most of we, Anne might know this better than I do, but how many of our members are on the sliding fee? And we do have folks that just join sale, pay the full membership to help support those that can't afford the full membership as well. So, Anne, maybe you can address that a little bit more too, but.
Yeah, it's hard to give an exact number because it does go up and down that number, but it's not a large a large proportion of our membership. But I guess what I would say is that we have people paying as low as $0 up to like $8 or $16 a month for membership. There are a few who pay a little bit more, but we do use the HUD guidelines to determine that. And we also take into consideration, for example, someone's income might be kind of on that borderline, but then they might be having a spouse in a nursing home or, having unusual and very extensive financial concerns. So we sometimes have people go on sliding fee for a time and then they go back off. They actually let us know if they feel that they can pay the full rate. We just don't want people to be left out because of financial stress.
Is it too gauche for me to ask what the fee is?
Oh, for membership or for
Yeah, how
sliding?
much does it cost to be a member of SAIL? And what's the difference between an associate and a full member? Hate to talk money here in an educational environment, but some people would like to know.
And that's quite all right. So our full membership includes all of the benefits that we talked about of getting the extra help from our volunteers. So getting the rides, the handy person crew, getting some free tech tutoring services, and the daily check-in, the daily Rise and Shine check-in program. And the full membership is $405 a year.
Mhm.
And the associate membership is about half of that. And so in that you still all of our memberships include access to our service provider directory, which again we said is one of the number one reasons people join SAIL is for that service provider directory. And they have access to all of our programs and events. But the full membership benefits are a little bit more with including those SAIL rides and volunteer services. I hope that wraps it up in a sum, but you can get all the specific membership benefits on our website too.
Mhm.
Mhm.
Is there an age component? Could anyone, could a 50-year-old or a 40-year-old be a part of SAIL?
55 and older.
55 and older.
The only place we discriminate is 55 and older.
Uh-huh. And
And
can
a
people
person
pay
can
by the
join.
month? Could you pay your
Pardon?
membership by the month, or is it a once a year payment that you would do that?
We can arrange either. A lot of folks pay annually just because it is a little cost savings to pay an annual membership.
Yeah.
And we do have folks that do pay monthly as well. Mhm. Mhm. What's the
I've
question?
been hogging the microphone. Please, someone else.
That's right. I think I answered your question, Rich, that the benefits can be paid in monthly. Yeah. Good.
Mhm.
They actually, if you have 4 rides a month, you know, even at $10 a ride, that's going to more than pay, for your membership. I mean, taxis are expensive, Ubers are expensive.
Oh
Does that
yeah.
include even if you live out in Blue Mounds and you need a ride into Woodman's?
We have one example. We had a sale member who lives in Blue Mounds, and she did need a ride home from, I think, Oakwood. She was at a program at Oakwood, and she needed a ride home. So I sent that request out to our volunteer crew and had one of our volunteers jump in and say, "Sure, I've got time. I'd be happy to do that." And so he so enjoyed the time that they shared in the car together and got to know her. And we were very happy that we could offer that ride for her. Um, and we can't always, I have to be honest, sometimes there is a dilemma that comes up. Maybe somebody, we can't provide a ride for them, but we try to work with them and find other options for them. Is getting them to and from where they need to go. Mhm.
I had a guy, a buddy of mine, like, asked me, if I know of any other ride services, and I didn't even think of SAIL as as a membership organization providing rides, but this would be a terrific alternative for that. He was thinking, well, how can I organize a ride service in my neighborhood
Yeah.
for people to get forth and back to the grocery store? But I'm going
Well,
to tell him about you.
Yeah.
I guess I thought it would be important to mention too that there are times where I have even shared with people, like callers, if they're just looking for rides and they need X amount of rides and there's no other backup system, whatever, we're really transparent about the fact, like Becky mentioned, sometimes we can't make it happen. It's not possible, but we always help to arrange a cab if that's the alternative and that's what they choose. But I think I would say too that part of what makes this model work is that we always encourage people to join it as a membership, not as a consumer-based, I'm going to pay this rate and I'm going to get XYZ in return. That it's really the spirit of SAIL to be helping each other and banding together. There are people who join who cannot, for whatever reason, volunteer or help out. But most of the people that join, or many of them, join, and we hope at a time where they can participate in some way. Maybe it's just giving us ideas on possible service providers. Maybe it's giving a ride, and then later on they say, well, someday I might need that. That's certainly not all of the members, but certainly it is many of them who join because they want to be a part of something like this and have that spirit of community and helping one another. Um, so it's just part of what makes that village model work.
Yes. Thank you.
Mhm.
Good.
Please feel free to unmute yourselves and join in the conversation. Don't be shy.
Well,
Well, if there are no other comments or questions, going once. Becky, I just want to thank you so much for taking all the time to prepare for us today and give this presentation. It's really great. And thanks, Anne, for making Becky available to us and for joining here this morning.
yeah.
It's always great to have you a part of our program. Next month, we're going to be having Diane Turner, who'll be talking about Safe at Home, the falls prevention assessment program that they have. And I'm looking forward to that as well. Diane's got a lot of experience to talk about. So please plan to keep your eyes open for that announcement too. All righty. Well, let's call her a day. Thank you, everybody.
Thank you.
Thank you.
All right. Bye-bye.
Bye-bye.